helping us get through this by educating the public and giving them the facts as this continues to remain a very fluid operation. I would like to first begin by having Dr. Jennifer Vegno, the health director for the city of New Orleans, give you an update on where we are in the city with our caseload. You know, we're at 827 with 37 deaths. And I would like to ask Dr. Vegno to come up at this time, and then we'll proceed throughout the press conference.
Thank you, Madam Mayor. Thank you, everyone. We remain very concerned about the number of known cases of COVID-19 that we have in New Orleans. As the mayor said, today's update from the state brings us to 827 cases in Orleans Parish, 37 of which have resulted in death. Compared with other counties around the country, what we know is that we have one of the highest infection rates behind several counties in New York City and a handful of others. To be clear, that's partially because we are doing a great amount of testing, more per person than most other states, and that is a positive development. With our drive-through testing sites that you've all seen and the commercial lab results now really coming online, we will soon have a much clearer picture of the true nature of the outbreak in our community. But again, what these numbers continue to tell us is that we have substantial community spread. Each of us needs to act as if we have been exposed to this virus. That's why it is so incredibly important to continue to stay home right now. The best way to slow the spread is to limit interpersonal contact between individuals to the greatest extent possible. I am really, really happy to say that our community members, all of us, all of you, have been listening. We have been on the streets. We have seen how little traffic there is. We have data from an external source that indicates that over the last week, there's been a huge decrease in the average distance traveled in Orleans Parish, more than almost anywhere else in the country. That tells me that everybody is doing their part, and we are so appreciative. That will save lives, but we have to keep it up. This is a marathon, not a sprint. We won't even be able to see or know the effects of our stay-at-home mandate for another week or more. We should expect that. That's due to the incubation period of this virus, and we expect to have a long road ahead to continue to slow the spread of the disease. So I want to prepare you now, as the governor said yesterday, that in the coming weeks, or even less than weeks, we will be facing a serious capacity problem in our hospitals. As more people get sick and as more people need to be admitted to our hospitals, we may run out of hospital beds. We have been preparing for this for weeks. Our hospitals have been preparing for this for weeks. We have been working with the state on hospital surge plans, which you'll hear about more in the coming days, and the governor alluded to today. Just like other major cities all over the world, we continue to face shortages of medical equipment, personal protective equipment. The major disaster declaration that the president issued last night, we hope will help to unlock the federal resources that we need to assist in this. Please remember that through all of this, our healthcare workers and our first responders continue to provide care at great sacrifice to themselves and the people they love. Many of them have been exposed to COVID-19 and are continuing to work safely with protective equipment as long as they can. There are many things you can do to support them, and really they and our vulnerable population are who we should be focusing on now. Don't become one of their patients. Stay home, avoid close contact with others. If you're a medical professional and you're not already volunteering or working, please do so. Sign up at ready.nola.gov to volunteer. If you're not a healthcare worker, there are many ways that you can help. Reach out to friends and family who are and see what they need, whether that's to drop a homemade meal off on their porch, to have some groceries delivered, whatever you can do for them. You can donate to groups like the Crew of Red Beans and other organizations that are employing some of our hospitality workers and feeding healthcare professionals every day. That's a win-win. Remember, they came to work for you, so please stay home for them. Thank you.
Thank you so much, Dr. Vegno. we cannot overstate just the thank yous that we go out or we put out, but also encourage you to do the same as it relates to our first responders who have been on the front lines from day one. This also includes, of course, our healthcare professionals. As Dr. Avegno alluded to, they are working tirelessly on behalf of all of us in our city. And they just deserve for us to follow the rules, and that means stay home. And the public, the public is responding, and we want to say thank you as well, again, to our residents who are staying at home and being very creative while they're at home, and that's a good thing. As it relates to our continued advocacy, I will say, at the federal level is where we will continue to focus. We are very grateful for the movement on last night as it relates to the governor's major disaster declaration also being approved at the federal level. That will unlock the resources that we need on the ground here in the city of New Orleans. However, we're pushing for more. On the front end of that is the 75-25 split that is required as relates to federal assistance, meaning that the city of New Orleans will be responsible for putting up 25% of the dollars. And so we're already cash strapped, as you know, and this will prove to be very difficult for the city of New Orleans to continue operations, but at the end of the day, to stand up government once we get through this pandemic. Also, we're pushing for individual assistance program at the federal level. We're asking that they really circle back on this to include the individual assistance program as part of the major disaster declaration. This will thoroughly assist our residents, but also as it relates to the feeding of our residents through the USDA food program. We're asking for the USDA to grant us a waiver. We have made multiple requests. Our federal delegation has been at the table literally relentlessly, even on calls this afternoon, and asking again for this flexibility for this waiver. Our food banks are in desperate need of additional food supply as we expect to run out as we move towards the end of this week and approaching next week. We're also asking that the local threshold in terms of the population threshold for state stabilization fund, and we're asking that's at $150 billion program that we're talking about. What we want is for this program to be more mirrored along the CDBG dollars instead of one with the requirements as they stand right now is for populations that are 500,000 people or above. And so we're not at the 500,000 population mark, as you already know, which is why we're pushing for that census, for everyone to complete the census. But at the CDBG level, that applies to municipalities 50,000 people or more or greater. So we're right, in that sweet spot. We're less than 500,000, of course, over 50,000, but the CDBG program works very much more efficiently, and this is what we are wanting for the city of New Orleans, for the state of Louisiana. Make no mistake about that. We are also wanting to ensure that DSNAP, that program, gets off the ground. We know that these dollars and all these resources will be in partnership with the state of Louisiana, going through the state, coming to the city of New Orleans. And so we are staying focused, keeping our eye on the ball, and that is where the rubber meets the road in terms of our ability to meet our people where they are. Dr. Avegno talked about surge. We've been talking about surge capacity for weeks now. But as we look at the upcoming, at the end of this week, looking at next week, that April 7th mark is a benchmark for us. we believe at that point in time we will have saturated our hospitals. And so we're working very aggressively at this time to stand up a medical station that will accommodate up to 3,000 patients. And so we're working on this now. I have our Director of Homeland Security, Colin Arnold, who has been on the ground with the state partners, with General Parker, with the National Guard. And I'll ask Colin to come up and just give a little bit more detail. Colin?
Afternoon. As you know, President Trump approved Governor Bell Edwards' request for a major statewide disaster declaration last night. Locally, that declaration allows us to be eligible for federal reimbursement for the emergency protective measures that we've taken and will take to respond to this continuing disaster. We're in constant communication with our partners at the state and federal government about ongoing needs, as you've heard, of which we have many. We're so grateful for the hard work being done by the nonprofit community and organizations and volunteers to support the needs of our most vulnerable community members during this time. Out on the front line caring for our people is you. If you can do a grocery run or order a meal for a neighbor in need, please lend a hand. Houses of worship and neighborhood organizations are also doing their part. Today we announced a new partnership with World Central Kitchen and Hands On New Orleans, which will deliver meals to homebound, low-income seniors or chronically ill residents who are sheltering in place. We know these folks face a greater risk of severe illness if exposed to COVID-19, and so many are staying indoors, and we encourage that. This program is for people who really have no other option. If you can afford to get groceries or a meal, this isn't for you. Folks in need of a meal delivery should call 311 to register. Meals will begin on Monday. We're also looking for volunteers to deliver meals. If you'd like to volunteer for that or any other means, please go to ready.nola.gov. These volunteer hours and donations are important because we can track them, we are tracking them, and they can contribute to whatever our federal cost share ends up being. And we are grateful for this. The drive-through testing program continues and is running smoothly. To date, we've tested 2,400 people at 2 sites in Jefferson Parish and 2 sites in Orleans Parish, and another 1,250 people at the Jefferson Parish site at the Alario Center. FEMA informed me today that we have become the standard for this program, and they are starting a resupply tomorrow. So we will continue this testing as long as we are able to with the supplies and inventory that we are given by the federal government. I'd like to thank the Louisiana National Guard. I can't say enough about the program that they've helped us with, the New Orleans Health Department, Dr. Jen, the Medical Reserve Corps, and also the U.S. Public Health Service, which has been on the ground with us throughout since Saturday with the testing sites. As Dr. Avegno said, our hospital capacity in this region is dwindling and will soon be overwhelmed. Our partners at the state and federal government have been tirelessly developing plans for a hospital surge and an isolation surge. We've already set up an isolation surge in the area, as you all know. With current projections, we expect to need additional hospital beds within weeks. As you're seeing around the country, Louisiana and New Orleans are preparing to mobilize in a way that many of us have never seen, and hopefully we will not have to see again in our lifetimes, but it is happening. This disaster will define us for generations. Thank you.
You know, you're only as effective as the people you surround yourself with. And it's just an honor and a privilege to have hardworking men and women continuing to keep government functioning and operating at our highest level and of quality. So I appreciate you, Colin. I appreciate you, Dr. Jen. You know, we're in this together. We understand that. We'll continue to not only uplift one another, but understanding that only translates and transfers to the people that we serve, and that is the citizens of the city of New Orleans, all of our residents who matter, and all of our folks who are on the front lines. I tell you, can't do it without you, and we really do appreciate you. On that note, I just want to go, Latanya, to questions and answers. I think that's always a good way to field, some of the questions that our reporters may have.
Absolutely. Madam Mayor, WWL.
This is from Paul Dudley. Today the governor said he's considering the Memorial Convention Center to house non-critical patients as hospital surge. How will it be staffed, and do we have enough medical personnel to care for those patients?
Sure. So we are standing up what we're calling our medical station. It will be able to provide service to up to 3,000 patients. These are patients that are positive, patients that have been getting treatment and service at our hospitals throughout the city, patients that will be moved towards or really going towards recovery, that will be moved out of our hospitals into surge capacity where they can continue to get the service, continue to get better, and the resources that they need, but also free up space at our hospitals for those who are suffering at a higher and greater level and who are even more vulnerable. This also speaks to the issues of ventilators. So we don't anticipate the use of ventilators at this particular surge station. What we do want to do is continue to free up those beds for our patients who will need to be on ventilators or who currently are. But as people move through recovery or move towards recovery, they will then be transitioned and relocated to the Memorial Convention Center.
I think WWL again.
Are there enough medical personnel in the greater New Orleans area to take care of this?
Well, one thing about it, and I'll bring Colin up as well, one of the things that is unique about not only the city of New Orleans, but the state of Louisiana in this pandemic situation is that we prepare for hurricane season every year. And so there are multiple contracts that we have at the state level, for example, in the need of a hurricane or a disaster. And so one of these contracts, and Colin can speak a little bit more in detail, but it was previously secured to stand up in the need of an emergency for additional medical professionals to provide those services to the state of Louisiana. And so we are ahead of the curve on that, and we will be able to have staffing to meet the needs of the 3,000 patients that will receive support and services at the convention center. We're also working with our higher ed community, LSU, as well as Tulane, and urging them to allow for their students to get the best training that they can receive on the ground. And I'm telling you, we had conversations with them today, and to think about getting, again, our students out of that classroom setting academically and really boots on the ground, rendering not only the best service, but also in a way that they can get the best experience. So with that, I'll ask Colin to give you a little bit more.
Mayor pretty much covered it, but it is a state contract that's been activated. They have minimums of amount of personnel in the thousands that can be here, and they have access up to 35,000 healthcare professionals across the country that will come here. This will not be necessarily our local healthcare providing this because the training obviously will be invaluable for students, but we know that our frontline healthcare workers in this community right now are fully engaged in this, and they're not going anywhere as far as from their facilities that they work at. So this is additional people coming here to do this. Thank you.
Fox 8.
Have you all begun to see any supply of the much needed medical supplies that are coming from the federal government, like all the PPE gear, medical, face masks and stuff? And then as a second question, what city services will be diminished in trying to meet the 75-25 split for the federal assistance?
Well, in terms of diminished in regards to that, I will not speak to that. The bottom line is that the city of New Orleans has been at limited, working at limited capacity, meaning standing up those departments that are deemed critical to operating city government, because we're still open and we're still doing business, and we have created systems and processes to where the public can still get the resources that they need, as well as get the services that they need from the city, but able to access them remotely. And so this was a game changer for us, and very excited about it, because I'm telling you, we've been able to stand up our assets that we were working to stand up in the post-cyber attack environment. So this speaks to, like, for example, code enforcement and safety and permits. We were waiting for our llama systems, different systems to come back online, and they're online. So we're at a better place than we were really since the cyber attack. So that's good news for the city of New Orleans and the services that we're able to provide the residents with. But as it relates to that 75-25, I think that's too early for me to answer that. In regards to equipment and PPE and what we're seeing on the ground, I'll have Dr. Avegno kind of speak to that, but we're seeing some things happen.
Yes, thank you. You know, there are many, many requests being put in. They are being taken care of at the highest levels. We are seeing equipment. The state, I know, has put in multiple requests on behalf of this region, because again, right now we are seeing the most number of cases in Louisiana. So I know that we have assurances that they are being delivered. We are getting them, again, just like everywhere else in the country. It is certainly not in the volume that we would like.
Jambalaya News.
To be able to get tested, do they need any state ID?
We can answer that. Just go on up.
Yes, ma'am. So as a requirement of the federal program, they do need to be a Louisiana resident for the drive-through testing. But other than that, the only other requirement is that they're symptomatic. They have fever, cough, shortness of breath.
And that's with the pilot program, which is a very different setup. So with the 2 drive-up testing sites that are affiliated with the federal program, a Louisiana state ID is required. In all of our other testing sites throughout the city, whether that is our FQHC, our clinics, our hospitals, and the like, no ma'am.
WGNO. WDSU.
This is from Sherman DeSalle. With the stay-at-home mandates by the governor and the pilot drive-through testing, do you feel optimistic at all about us seeing a change in the trajectory anytime soon?
Well, with the increase in testing, as well as the flexibility granted by the federal government for lab testing, meaning locally, like with Oshner, for example, I'm feeling confident that with the data collection methods, that we will be able to see where our curve is. Dr. Avegno has been charting this data every single day with charts and all of the data analytics that are needed. And it's making us, we're not out of the woods at all by any means. But as we get the data and learn the data and see trends, it helps us have a better understanding in terms of how we're impacted and how long we should be in this. But I'll let Dr. Avegno give you a little bit more detail.
Yes, as with anything in science, the more data you have, the better your decisions can be. And so that's very helpful. But that does not mean that we are looking anytime soon to expect, one number is not a trend. We know that this is a long tunnel. We're at the beginning of the tunnel. There will be a light at the end of the tunnel. But we're taking everything as it comes and just really hoping that we can curve sooner than we think, but we're in this for the long haul.
And the second question is, a couple of weeks ago you talked about the conference calls with community groups. Has that continued, and if so, what's been discussed and what are some of the group's concerns?
Well, I think we've covered majority of the concerns, really all of the concerns, and not so much with this press conference, but as we have been communicating and pushing out information and data to the public on all levels. The public, of course, is concerned about testing, as they should. They've been concerned about access to unemployment insurance. They've been concerned about, layoffs. They've been concerned about first responders. They've been concerned about making sure that they have adequate food supply and nutrition. They've been concerned about our seniors, those that are sick and shut in. They've been concerned about our homeless population. I think they've been concerned about everything that we're concerned about. And I think that's how I know I gauge my focus and my priority is from that bottom up. And so, yes, we will continue to have outreach, absolutely. We cannot get through this without community, and we just can't. So having the lines of communication open and always being accessible to listen is a priority for my administration, but it's going to be the only way that we can really respond to the needs of the public. And so, yes, we'll continue to do that on all fronts, with the general public, with our hospitality and tourism industry. I have calls every day with the business community, with our faith leaders. Even started a committee focusing on deaths and burials, meaning from the funeral community, meaning the mortuary community, and looking at policies associated with that. So we're focused, and I'm telling you, it's what we get from that ground that keeps us not only focused, but on what's priority.
The advocate.
Madam Mayor, can you say anything about how the city is working to care for its homeless population and whether there is a plan in place to move that population not just to Bayou Signet, but potentially to hotels or motels in the region?
Well, I mean, I'm the one actually who started to, meaning the city of New Orleans, as we're focusing on our most vulnerable, our homeless population is just that. And as we saw, not only with the businesses being operating at minimal capacity, and listening to my director of the mosquito and rodent control, who saw that as a result of some of the closures and with bars and the like, that it has been driving our rodents crazy. And so with that, we have focused even more so on our street homeless, and not overlooking our homeless that are in our shelters, but there's a sense of wraparound services that are there that are not so much accessible on the ground, meaning our street homeless, as I've talked about and reported on. And so we have shifted our thought and our processes as it relates to where we will relocate our street homeless. We do expect that to come to fruition before the end of this week, meaning moving our people. And so those plans are in the works. We've been working very aggressively over the past several days. And I want it to be a very seamless operation. I have pushed back on various options that was whether it was moving our population multiple times. I don't want to do that. I want to be able to move our people once and therefore provide adequate resources that they will need to meet the needs of that vulnerable population. So whether that is, of course, the wraparound services, mental health, case management on the ground, making sure that they have the resources that's needed to fully operate and in a long-term capacity, and using this time to continue to stay focused on what we were doing prior to the pandemic is focusing on our street homeless, but in an area that would be more permanent. So kind of using this time to not take our eye off the ball for the long term, but this is going to be a short-term solution while we move through and get through this pandemic.
And we've heard a lot from hospitals this week about the PPE levels there and the shortages and how they've had to reuse equipment and gowns in some cases and the things that they're doing to be innovative. Can you speak to anything that the first responders are having to go through in terms of PPE, whether they're reusing, whether they're putting it on the patients instead of themselves, and whether or not y'all have partnered with, I heard today, the 3D printers for the face shields, and are y'all doing some of that? Can you talk a little bit about that?
Yeah, well, we're being very, very creative, and know that our healthcare professionals are doing so as well, and of course wanting to protect themselves but also protect the patient. And so I'll ask Dr. Begno to just give you some insight from a healthcare professional's perspective.
Yes, EMS has been, as you know, very on top of making sure their responders are as protected as possible. Whether they are all wearing masks, they are putting masks on patients when they know when they get a call if they should expect that it's going to be a potential COVID call, and so they're doing everything possible. And thanks to NOSEP and others, we've really been able to try to stay on top of PPE shortages. Speaking with my colleagues across the city, they are being creative. They are, like many other places, finding ways to safely reuse equipment. There was a chart passed around my ER colleagues today showing the best way to re-sanitize an N95 mask, and all of that is information that's helpful. We never wanted to be in this situation. We never wanted to be in this spot of having to reuse masks, but professionals are every day making decisions to keep themselves as safe as possible, but also not to be, to understand the limitations and not to just blatantly use too much, knowing they're all aware of the situation we're heading towards. And so it's really making the best choice you can in the situation, and I think they're doing it beautifully.
Anyone else? Someone though?
They're standing tall for us. They are. They really are.
Someone though?
No, it's okay. Young girl, say.
No, he doesn't have questions.
He said no.
No question.
Okay. All right. Well, thank you all again. We'll continue to keep you informed, and just can't thank you enough. This remains a very fluid operation and situation that we're in, and so we'll meet it every single day. Meet the challenges. Thank you.
Thank you all.
Thank you all.
Y'all hanging in there too.